Welcome to Tees Voices, telling the stories of the people in our NHS community.
My name's Elliot, and in the studio today we have Demi and Lauren. What is the People's Promise?
So the People Promise was formed by NHS staff. There's 7 elements to how we can together improve the experience of working in the NHS for everyone. We need to make our People Promise a reality so that the NHS can become the best place to work for all, where we are part of one team that brings out the very best in each other. This is why the 7 elements need to become business as usual for all. This aims to provide people a place of belonging, allowing growth for the future and supporting our staff now and longer term. Ultimately, by looking after our people, that we then achieve the People Promise plan.
So what is flexible working and how can it affect our staff?
So as a trust, we have to be committed to creating a culture where flexible working is welcomed and supported. Having those healthy flexible working conversations with your team and managers early on. This develops a better working environment, which then delivers a better service and better outcomes for our patients. This also improves staff engagement, experience and well-being. Teams need to work together to improve work-life balance and also understand that this has to suit the service needs. Anyone can have these conversations regardless of your role. The understanding of flexible working needs to be that it's not just for working carers or childcare. There's lots of options under flexible working, which is why having early conversations are so important for long-term arrangements. All informal and formal flexible working agreements should be documented onto ESR. All of this then leads to a healthier and happier workforce. There are toolkits for all to access to have those early conversations around flexible working, which are now available on our staff intranet page.
So where did the flexible working toolkit idea come from?
So I was kindly invited along to the NTH 100 programme and I was part of the cohort 3 programme. The project I was given along with some colleagues in the organisation was how do we support flexible working for all of our workforce. So we know that many NHS organisations have flexible working policies and as such feel as if they are already offering flexible working options. However, we also know from the NHS staff survey that many people still feel unsatisfied with their opportunities for flexible working despite the existence of these policies. We also know that staff often cite work-life balance as a reason for leaving the NHS, which may in part recognise that our people don't feel that they have the flexibility they need to achieve the right balance for them. So initially we looked at the barriers to flexible working and the common themes that emerged were concerns about complexity or cost, hierarchy of needs, the needs of the organisation versus needs of the individual, and complex team dynamics. Laid out in the NHS People Plan, the NHS will continue to commit to offering more flexible, varied roles and opportunities for different types of flexible working. So using the NHS staff survey from 2022, we picked the departments that scored over 80% for being happy with the flexible working arrangements within their teams. We then raised the question to their department leads via email. What flexible working options do you offer to your staff in line with the Trust's flexible working policy? And we were able to gather some feedback from those teams and those were then themed. At this point we then gathered more data using Slido and the questions that were posed were, are you aware of the Trust's flexible working policy? And if yes, which elements of the flexible working policy have you applied in your area? We had a really good response rate. We actually got a 69% response rate. And at this point, it was then decided that as an organisation, we needed to have a flexible working toolkit put in place. So we looked at the NHS England's flexible working toolkit, which was put in place as part of a national drive to support improved work-life balance, staff wellbeing and retention across health services. So we then adapted that flexible working toolkit for individuals and the line managers to fit in with our trust. At this point, the flexible working toolkit that was developed by myself and colleagues as part of the project was handed over to our People Promise Manager to then go about implementing within the organisation.
What are the challenges, if any, have you faced with the flexible working?
So the terminology used with flexible working I feel is sometimes a challenge within the organisation. But this is why, as a trust, we have rolled out flexible working workshops. This is to help with that understanding. And there is also up-to-date leaflets and guides on the intranet to help with this challenge. The other challenge, I feel, is the trust around productivity, However, there is evidence out there that suggests flexible working actually produces a happier workforce. There is obviously reduced visibility though sometimes with the flexible working options available, but how do we overcome this? So by having empowered line managers with strong communication and technology. So we can utilise our team coordination tools such as our digital platforms. So we have access to MS Teams, shared calendars, which allows our staff to always stay connected. It's also important to set clear expectations and have regular check-ins with our staff. And this in turn fosters a supportive culture.
So how does staff initiate the flexible working request?
So a flexible working request can be discussed with your manager. This could be within appraisals, one-to-ones, or just a general catch-up. You can use the flexible working toolkit, which is on the intranet, to aid these conversations if needed. The understanding of requirements of staff and to your service need. You would then need to come to a flexible working agreement, and it's really important that this is documented on ESR. I know people feel that this is quite formal, however it helps us capture these conversations and also gather the data. This can be inputted onto ESR as a temp or permanent request. Those early conversations are really important to make people happier at work. The contacts are best through people services, the OD department, or you can get all the information on the staff intranet page.
Demi, Lauren, thank you.
Thank you for joining us. Till next time, you've been listening to Tees Voices.